A dedicated hypertension clinic is one of the valuable additions SouthCoast Health has made to Savannah.
High blood pressure is often associated with other problems. And joining us now, SouthCoast nephrologist Dr. Garrett White. Good morning.
Morning. How are
Good
you?
morning, guys. How are you?
This is exciting. This is a still relatively new.
It's relatively new, 6 months in, and we decided that one of the things that we see in our community in Savannah is that patients have or suffer from hypertension, and one of the things we think is the more we can get them earlier and get more of a collaborative approach to help them, the better.
Is that because of diet, because of lack of activity, all the above?
Yeah, all of the above.
Right.
And I think that we understand that sometimes people, unfortunately, about hypertension, is that it's kind of a silent kind of killer, you know. And you know, when they come to me as a nephrologist, it's usually at the point of too late, dialysis, transplant. So what we wanted to try to do is get them earlier. And we thought that if we had a collaborative clinic that had not only address those issues you talked about of lifestyle, exercise, diet, and put that in kind of a collaborative clinic and address that early on. That's kind of what our goal was in this project, in this hypertension clinic at SouthCoast.
We've had doctors on talk about how big of an issue diabetes is in our community.
Yeah.
Is hypertension kind of a gateway to those other conditions, or do they come first? Or
Yeah, I think hypertension is probably a gateway is a good word, I think, but I think more of along the lines. I think of hypertension and diabetes kind of along the same spectrum.
Oh, okay.
So what I see again in my world is hypertension, diabetes, kidney failure. Same thing: hypertension, diabetes, cardiovascular disease, hypertension, diabetes, stroke. So we realize hypertension is that gateway, is that point where you can really get in there. If you can get that first and begin to address that appropriately and aggressively. Early on, those things that it leads to can be prevented.
Is hypertension simply high blood pressure, or is there a lot more to it than that?
It's high blood pressure, but you know, like any pressure situation, anytime there's pressure in the vessels, and that's what causes the problem. So, and it's not just. And I think you brought it up again, and I think it's important to understand pressure is a lot of factors that address it. It's not just. It's not just genetics. It's you know, lifestyle and a lot of modifiable things that can be done.
How can you start to figure out that you might have a problem with this?
Yeah, so it's a great question, because that's the problem that I think I struggle with my patients, is letting them know that they have a risk for hypertension. I think obviously knowing your history, getting an exam with your primary care physicians, I think is an important part of the process, and I think. And realizing that once you're diagnosed with hypertension, the problem is usually they don't really have the symptoms. It's just beginning to get them to understand that it's important that even though you have high blood pressure, and even though you're not feeling any symptoms, it's important to begin the process of beginning to address it.
But as you said, a lot of times by the time you see somebody, the problem is there.
Yeah, unfortunately, that's where I'm at, and that's again what was my motivation for this clinic. Because by the time they get to me, there's things I can do in nephrology and hypertension management and control, some complications. But by the time they get to me, they're at a point where I wish they had come 20, 30 years earlier.
so where can everyone come find you and make an appointment?
So what we have is the SouthCoast has a hypertension clinic. We kind of run it across all of our primary physicians' offices, but I have a clinic dedicated Fridays from 9 to 12.
Okay.
It's on Eisenhower Boulevard in our main SouthCoast building. We're going to do it every Friday, and part of that too, again, as I said, is going to be a dietitian. We're going to do pharmacy, adherence reports, and all those kind of things, because what we didn't mention is adherence is the main part of why high blood pressure is not controlled. People just don't take the medicine because they don't realize what they need.
So the first hypertension clinic in Savannah, hopefully first step to maybe making a healthier Savannah.
Yes, sir. Thank you.
Doctor, thank you so much.
Thanks
Appreciate
so
you.
much.
Being here.
Thank you.